And hello everybody, welcome to episode 17 of the GrowCast Show. Today with me, I have Mr. Rodney Lim. He is the pioneer of the Painless Laser Acupuncture Therapy in Singapore. And I'm so glad, I'm so happy to have him here today. Rodney, how are you feeling today?
Good. Thank you for bringing me here. And I wish you a happy 2024 New Year.
Happy New Year to you too.
Happy New Year.
Happy New Year to you, Rodney, as well. So, Rodney, I always like to ask my guests this one of my favorite questions, which is, what does being better than normal mean to you?
Well, being better than normal, to me, it means one up on me. And what do I mean by that? To me, it means that I can do certain thing or solve an issue or a project that some others cannot do or they do not want to do. For example, like many of my practitioners are using the acupuncture. And for me, actually, I'm doing advanced acupuncture because I use with laser technology. So that is a value-added therapy.
Yeah. Something new, something different, right? That's what better normal is all about. Am I correct?
Yes.
And maybe you can share with us a little bit more, Rodney. What makes you better than normal?
Okay, what makes me better than normal means that basically I have to work hard. I have to have a commitment. And actually, I'm very passionate in my job. And, I really go all out to help my patient rather than just concerning about the commercial aspect of it. So I want to make sure that they can recover with my help. And also, I point out to them how they could help themselves as well. So this is my concept of therapy.
Because so that they don't have to be dependent on you, right?
Correct.
You want them to be independent, right?
And that's right. That's
nice.
Exactly right.
And maybe, Rodney, you could share with us a little bit more. What is your origin story and how did you get started?
Well, this one, I would say, it's quite a long story. I'm from the old school, actually. After my army, actually, during that time in the 70s, shipbuilding was the kind of a trend. So I also was getting excited and I want to join the industry. But apparently, somehow, perhaps it's by divine, that I've been so-called ushered to a traineeship scheme whereby I work with the first broadcasting company in Singapore. Perhaps you may have heard it, Revolutionizing. So, I signed up a traineeship with them in all aspects of their engineering, in terms of broadcasting, transmitting power stations in the control room and all that. And I learned a lot of things. And especially in the control room, we have to make sure that the amplifier, the sound system, all these are in tip-top condition so that you can get your news and your program. And especially the news must be broadcast on time, exact time. And this is what I learned. Yeah. And also I had the privilege to learn about TV, black and white TV, and also one of the few who have been selected to do the color TV servicing in the 70s. And that's where I pick up troubleshooting technique. And until this day, I apply my electronic principle to troubleshoot my patient. So just by looking at their face, I can actually assess some of their medical issue or imbalances. So that's where I had learned a lot, from this early training.
And how did you transition from the TV into the health sector? How do you transition from media to health?
Yes, actually, I worked for Revolutionizing for 8 years. And after that, I joined a medical company. So at that time, Mount Elizabeth Hospital was in the process of completion. So I worked for the medical company as a service engineer to so-called manage their equipment to supply to Mount Elizabeth Hospital doctors and other clinics. But I don't know whether it's fortunately or unfortunately, after 1 year, there was a reorganization of that company. And I became actually their subcontractor. So that's how I started my medical field. And from there, apparently after working for about a year, I was headhunted by an American company to go to US to do something more exciting in terms of marine electronics, like radar and satellite communication. And that's where it's another journey. And from there, again, I worked for them for about 3.5 years. And after that, one day when I came home, because at that time, I was the Far East Regional Manager and also director for this American company. And I traveled extensively, almost 2 weeks a month. Until one day I came home, my daughter, which was very young then, about a year plus, I came back, I wanted to go and hug her, and she was start crying. So looking at me like a stranger, So that set me thinking. And that's why after about 3.5 years, I left to come back to the medical field again. And that's why one day I attended a medical exhibition. And also at that time, I have some medical issue on my leg. Actually, there's some edema on my ankle. And as you know, this kind of a condition, medically, the doctor cannot help me very much, just giving me painkiller and all that. So I approached this exhibitor who was doing laser. And that's how I explained to them my condition and say, sure, these are very good. The laser is very good for this sort of condition. And after treatment, immediately, I felt the relief, and it's just like magic. And eventually we start discussion and, ended up we become their distributor. And so we are the first to introduce laser in Singapore.
So maybe Rodney, you can share with us, what is laser acupuncture therapy?
Okay, laser acupuncture therapy actually uses a very so-called unique selective pure light energy, which is non-invasive. And we use this light energy to stimulate on the acupoint so that it can promote healing and also improve the blood circulation. So as a result, all this, it helps in the relief of pain and also their recovery. Yeah. So ideally speaking, laser therapy is not just replacing the needle with the light, but it's a very selective type of light energy that you can apply on the appropriate acupoint on the meridian pathway of the body. And this is where we can promote the healing. Yeah.
Very nice. And I know that you are the pioneer of laser therapy in Singapore, right? Can you tell us a bit more? I know at one point of time you were the patient and then you became a distributor, right? Can you tell us your journey with laser therapy? How did you go from being a patient to a distributor?
Oh, okay. Actually, initially we have a medical company, and that's where we can distribute the laser, because all these lasers are regulated by the Health Sciences Authority. And when we introduced the laser into Singapore, in fact, all the major hospitals in Singapore use our laser. And eventually, our salespeople had almost covered everybody, that there is no more room. And that's how we turned into the TCM sector, so to speak. So it was so coincidental that at that time, one of the TCM physicians also was looking for laser therapy, because the patients are afraid of needles and, of the pain and all that. So eventually, this physician bought our laser, and then we became good friends. And it was so coincidental that it turned out he was also the president of the Singapore Acupuncture Association. So that's where he was the one who is instrumental to recommend me to study TCM. And that's how eventually I learned about the traditional Chinese medicine and acupuncture. And during that time, in fact, TCM is not recognized in Singapore. So this is how we learned. Yeah.
And maybe you could also share with us, Rodney, I know you've brought your equipment, but can you share with us, what is this equipment and what does it do?
Okay, actually, this laser here that I brought, this is a smart laser. because it's just like the technology of our mobile phone. A few years back, whereby we all each have a mobile phone. So if I want to call you, perhaps I will SMS you or I just call you. But these days, with the smartphone technology, you can be in, Australia, in Japan, or in Taiwan, or even in India. I can just pick up the phone and talk to you face to face as if we are, sitting next to each other. So with the technology, the laser that I brought here today, actually this is what they call a smart laser, because all the program for therapy is programmed inside here. Like the acupuncture meridian, all the 14 meridians are all programmed inside the system. So for example, let's say you have a cough, as a practitioner, I know how to treat a cough. But right now, mostly for a cough condition, your lung may be, infected. So I can select the lung meridian to treat. So you can see the efficacy is one up than the normal just treating the lung meridian. Yeah.
Makes sense. And how does laser therapy acupuncture actually work?
Okay, actually, this is a very complex subject. But acupuncture today is no longer considered a pseudoscience because it has been proven by laser color flowmetry and also the thermography, functional MRI, and even sonography. So what happens is that when the light energy penetrates into our tissue, the cells, especially the mitochondria, will absorb the energy. And that's where it will trigger the ATP. It's just like, in the morning I charge my phone, my battery is in the 100%. So, it allows me to make calls or video or whatever I want. So at the end of the day, the energy battery will drop. So similarly, the cells, they need the energy to function. So with the laser, the ATP will produce the necessary power to drive the cells, so improve the circulation, to clear your lymphatic, and that's why it promotes healing.
And what pain does laser therapy acupuncture actually treat?
Oh, actually, when you talk about pain, there are various types of conditions, like muscular skeletal pain or neurotherapy, like nerve pain. All this, the laser is very good. But broadly speaking, there are 4 classes of pain that the laser can treat. So the first is actually what they call nociceptive pain, which means that if you have an injury or you have a fall, so these are the type of pain. And the other type of pain is what they call the inflammatory. There's some swelling and all that, and edema, this causes pain. And of course, the third group is what they call the nerve pain. So, the laser also is very good. And finally, you have what you call, out of the blue, there's no cause of pain, but you have the pain. So medically, this is what they call fibromyalgia, whole body pain. So the laser is very good to address this type of condition because, it can help you have the pain relief without taking any medication and also to prevent any side effect.
That's quite an extensive range of pains that it actually
Yes, that's
nice.
right. That's right.
And I know also you mentioned that the laser therapy helps to treat addiction, right?
Yes.
What are the common types of addiction that laser therapy helps to treat?
Okay, the common type of addiction is like we can treat alcoholism, like nicotine addiction, and also these days vaping and gaming, and also substance abuse. All this, it can be treated, yes.
And how exactly does laser therapy help with addiction therapy?
Okay, basically what it does is that we work on the neuropsycho pathway because our brain is very unique. When you say you smoke, the nicotine will be able to trigger like the endorphin, dopamine, all that. So that gives you the reward pathway and you felt good. But this so-called reward or the nicotine effect will last you, say, for half an hour or maybe an hour or even up to 2 hours. Subsequently, when this the nicotine substances effect has gone down, then you begin to get agitated, you get the urge or the craving, and that's where you will go back again. But with the laser, there are specific points that we can apply the laser energy. So what it does is that the sensory nerves, all this and the tissue will sense the energy, and it will travel along the dorsal horn to the brain, and the brain will release natural neurotransmitter like endorphin, dopamine, serotonin, oxytocin, and then that's how you feel good. And this, is naturally from yourself. So there is no cause of side effect. And over a period of time when we do that, basically we are regenerate your organ to function as before. Before you're a non-smoker and you function well, and then because of the habit, you pick up, and that's how we get addicted to the nicotine.
So because you see, addiction is such that there are two types, right? One is something you're addicted to physically.
Correct.
And then what if somebody is addicted to porn? Does laser therapy help with porn addiction?
Yes, basically, I would say that all these act on the neuropsycho pathway. So, when we treat, we'll be able to balance the body system, and that's where you can think straight. So similarly, it's just depending on the severity, so it varies with the dosages. Yeah.
And when we do laser therapy for addiction, because when you've got a pain, let's say I've got a knee pain, we do laser therapy on the knee, right? For addiction therapy, which part of the body do you do the laser therapy on?
Okay. For the addiction, actually we work on the sublingual, under the tongue, as well as on the body points. So as you know, in the mouth, it's very close to the brain, and the sublingual artery will be able to deliver the energy to the brain and to activate the brain to release the neurotransmitter of endorphin, dopamine, and serotonin, all this, so to make you think straight, so to speak. Yeah.
And I mean, you see, when you mentioned to me laser therapy in my tongue, right, then
Yes.
automatically it sounds very dangerous. And I'm sure that's a common misconception that you have as well.
Yes.
So maybe I can ask you that question. Is laser therapy safe?
Yes, laser therapy actually is safe because there are different classes of lasers. You have what they call the low power laser and the high power laser. And the misconception is that because, as you know, the acronym of laser, LASER, stands for light amplification by stimulated emission of radiation. So when people hear the word radiation, they kind of very concerned because, they go to their doctors. The doctor may have the MRI or CT scan and X-ray and say that actually, you're not allowed to have a lot of exposure of this radiation on your body because it damages your cells and it can cause cancer. But actually, this is not truly correct. But of course, you don't do it on an uncontrollable manner. So if you do it in a proper way, actually laser therapy does have benefit even for cancer patients. Yeah. So how does that work? Is that, the patient, they have the pain, they have no appetite, they cannot sleep, they have constipation. So with our therapy, we help in all this. And this will improve their immune system. And that's how they feel better. And actually, the body immune system fight the cancer rather than, using the drug or whatever to fight the cancer. Yeah. So they do it naturally, internally by their immune system.
Maybe we can go a little bit deeper into that because you see, cancer is such a common illness in Singapore, right?
Yes.
So I know obviously laser therapy does not cure cancer, but how does laser therapy help patients with cancer?
Yes, so as I mentioned before, actually right now there are research that's going on to mitigate the effect of laser cancer patient, how the laser therapy can help them. Because actually, as you know, when patient has cancer, they go for the invasive therapy like chemo and all that. So this damage their cells, and also they have a lot of pain. And as a result, sometimes they have insomnia, they had no appetite and all that. So with the laser therapy, we help in all these areas. So as a result, the patient immune system improve, and that's how they can have better quality of life. And of course, this has to be further studied and researched further, so that to give more confidence to those patients who had cancer to accept this type of therapy.
Understand. And also, I know, Rodney, you've been featured on multiple publications, right? What are the popular publications that you have been featured on, and why did they feature you?
Oh, okay. In fact, I'm the first TCM physician to have my paper accepted and published by medical journal. So one of the journal is the Annual Academy of Medicine. So this is a medical journal, and I was featured. In fact, almost had a hat trick. I had it in 2015, whereby I shared the use of low power laser for low back pain. And they accepted my paper and published. And also in 2016, whereby I used the laser as anesthesia for teeth extraction. And again, my paper is accepted. Unfortunately, in 2017, I had another paper on smoking cessation. Then they told me that, for this year, they stopped the Annual Academy of Medicine. So I could not be featured there. Otherwise, I would have a hat trick. So they put me in the Singapore Health and Biomedical Congress magazine. Yeah. And of course, my other work also is featured in the American Academy of Medical Acupuncture. And this is a peer-reviewed paper by Mary Ann Liebert Inc., the publisher of this medical journal. And my paper is peer-reviewed and accepted. And that's where they publish it in the American Academy of Medical Acupuncture. Yeah, and of course, I have other contribution, like in Beauty Magazine, in Female Magazine, and all that. Yeah, and international congresses and conferences too. Yeah,
very nice, and almost a hat trick. What a miss by a little bit.
Right, the Annual Academy of Medicine. Yeah.
Okay, and I know that laser therapy, you've been doing that for a while, but how long has laser therapy been around in Singapore?
As you know, we are the pioneer. So we started out in 1985, and it was from there. We worked with the NUH, and then SGH, Tan Tock Seng, Mount Elizabeth, Mount Vernier, and all the major hospitals. The physio and rehab, they use our laser, and we conduct a seminar. We conduct a workshop to train the doctors and the nurses too. And, doctors from this region, like Malaysia, Indonesia, Philippines, Thailand, all this, they come to attend our conference and the workshop. Yeah.
And I know when you say when you were working with SGH, Tan Tock Seng, right? So were they using the same equipment that you were using, and were you training them? Or how was Tan Tock Seng, SGH, and all the different hospitals working together with you doing laser therapy?
Oh, okay. As you know, at that time, the laser is more of the older generation, not like now we have the smart laser. So I also went to Italy, went to Germany, went to UK, to US, all this for my laser therapy training. And from there, the user, like the hospital, the physio, all this, they are basically our customer. So, I have to provide the support and train them, because I have learned from the scientists, the researcher, the engineers from the factory. And that's why with my knowledge, I share with them. And also we invite doctors to Italy, all this for training when they buy our equipment as well. Yeah. And in fact, we are proud to say one of the VIP from Malaysia, Dr. M, is also one of the users of our laser therapy, because his doctor came to learn, and that's why after that they bought, and he also treated him. As well as we have the families of the Indonesian president. They also use our laser for aesthetic treatment, and in fact they have their own beauty clinic. They bought our laser, and I go there and train their esthetician, how to treat, and also like on hair laser treatment and all that. Yeah, so we are privileged to have them using our device as well. Yeah.
Rodney, what exactly is the difference between TCM and laser therapy?
Okay, TCM and laser therapy, actually, they are in fact two different modalities. So each has their own function and benefits and also application. So when you talk about TCM, traditional Chinese medicine, actually it consists of 4 subspecialty. So a lot of people know that TCM actually is herbal medicine, and actually it's more than that. It's herbal medicine, traditional acupuncture, what they call massage or tuina, medical massage or tuina, and of course surgery. Surgery, as you know, TCM is the mother invention of China. And China, in the old China, they are shut out to the outside world, and they do not use any Western medicine. So during the warring period of China, when the soldiers they get injured, so the physician has to treat them and even perform surgery. However, in Singapore, surgery is out of the question for us because we are not trained. So therefore, in Singapore, TCM basically consists of herbal medicine, traditional acupuncture, and also medical massage or tuina. So in terms of laser therapy, laser therapy, basically, we are talking about light energy. And, the use of light in medicine actually is not new. It started even before the 1900s, where this Professor Neil Vincent, he was the first to use, radiation on the patient. So he used the ultraviolet to treat this lupus vulgaris very successfully, and eventually he developed phototherapy for skin diseases and all that. And later, that's how light came to being by the inventor Thomas Edison, whereby he invented the incandescent light. Right now, is in all our household. And from there, he prophesied that actually light is the new medicine. And he said that, the future of medicine, the doctor will no longer give any medicine, but just giving light therapy. Yeah, and actually I'm one of the followers of the light therapy. And laser came about is actually from, Albert Einstein with his quantum theory. And that's how that was evolved. And eventually we had the first laser. That was the ruby laser by this Dr. Maulmin. And that's where the laser technology slowly evolved. And when you talk about laser therapy, actually we have to pay tribute to the father of laser biostimulation. And it is Professor Andre Master. And also I had the privilege to meet his children. There are 2 sons. They are both doctors in conferences and seminars. And I also had the privilege to go to Hungary, and they invite me to their house for dinner and all that. So I'm very privileged to have that. And it was through Professor Master that laser therapy is being researched thoroughly, and that it is safe to be used for our treatment today.
How long have you been certified in TCM and recognized in Singapore?
Okay, actually, when you talk about certification, I had my diploma in clinical acupuncture way back in 1989. So, as you know, in the late 80s and 90s, TCM is not recognized in Singapore, which means that, if you think you can help a sick patient and you treat the patient and the patient get well and he has confidence in you, you can continue to treat him and charge a fee. But unfortunately, this no longer the case when it came into the late 90s. So that's where the ministry, they regulate traditional Chinese medicine. Even though they regulate traditional Chinese medicine, acupuncture is the first modality that they regulate. And that was, eventually the law was passed in year 2000. And actually I had my provisional license in the year 2000. And I had it for about more than 3 years. And in 2004, I've been certified with full registration to practice acupuncture. Yeah.
Very nice. So that's about 20 years now, yeah?
Yes,
Very nice.
that's right.
And-
Time flies.
And Rodney, what happens in the first session of laser therapy?
Okay, laser therapy, as you know, is using of gentle light energy. So when the patient comes for the first session, normally what we would do is that we have to assess the patient condition and to understand their medical history. And then from there, we will so-called advise the patient, which is the good modality to use. Because, as you know, I've been trained in the traditional way. We still can use the needle acupuncture, or I can use the laser acupuncture, or the combination if their condition is very chronic. Yeah. So this is how we would advise the patient during the first session. And you can be assured that without therapy, the patient will be very happy. When they come in and then when they get out of my door, they will walk differently. They will get the immediate pain relief after the first session. Yeah.
Very nice. And also, we are nearing the end. And the last question that I have for you, Rodney, is who are the list or who is in the list of top sports people or medical specialists that you have helped with laser acupuncture?
Well, in fact, I should say that I'm privileged to treat some of our local sport personality because actually I'm a member of the Singapore Master Athletic Association as their acupuncturist. And one of the own Singapore sports personality is our Singapore professional boxer, Muhammad Rizan. So I had the privilege to treat him and help him win his fight, even though his competitor was out of the weight range because his real opponent was supposed to fight with him. But unfortunately, on that day, he met an accident and he was replaced with another bigger size opponent and he knocked him out in the 9th round. Yeah, this is our own Singapore professional boxer, Muhammad Rizan. And also I had the privilege to help our Singapore marathon queen, Jasmine Goh. She's the Stand Chart Marathon champion in 2016. Also, she had an ankle injury, and after I treated her, she could manage to participate in the marathon, and she came in second in 2017. Yeah, and there are other sports and competition that she went further to participate and won as well. And internationally, I had the privilege to treat the world champions sprinter Andre Carson, 1993 Olympic champion in the relay team. And, I had the privilege to treat him because he was passing Singapore. And then that's how he found me and treated him. And also I treated famous New York choreographer Sari Labi. He also came to Singapore and then he was sick. And then, he was referred by the hotel to see me. And I managed to help him. And of course, even medically, I have helped doctors who had very chronic aches and pain, and also all this type of chronic issue, which medically, they just give the relief. And I have treated and helped them like knee pain, low back pain, and, cervical issue and all that, and some of the medical issue as well. Yeah.
And that's nice. I mean, people all around the world are actually coming to you and seeing you, right? But we need to bring laser therapy to more Singaporeans. I definitely need to come for one therapy session with you as well. And
Yes.
Rodney, thank you so much for being here. It was a real pleasure, a real honor having you here as well. Any last messages that you have that you want to share?
Okay, actually just late November, early December, I had the privilege to treat one of my patients from Middle East. He actually had, very chronic diabetes as well as prostate issue. And he came to me and, it was a very intense 1 week. We had 2 sessions a day, one in the morning, say 10 a.m., and one in the evening about 4 or 5. And he has just written to me and that is very happy with the treatment. Yeah. And also I have feedback from patients across the Causeway, Malaysia. And this gentleman also had chronic back pain. And now, he's so happy. And that, in fact, I had the best present this Christmas because he went around to shop the best organic banana and buy me a whiskey cake to present to me. And also had reported to me that actually he went for his medical checkup and his blood sugar level was below 5. And, he had never seen that kind of a result for the last 15 years. Yeah, so I'm grateful that I can help these people. And also currently I'm working on project to help injured foreign workers in Singapore. I do community service twice per week to help these people at the Singapore Accident and Help Center. And we are still ongoing. Yeah.
Very nice. And let's bring this conversation further. I know you've got lots of testimonials, lots of case studies. I want to bring laser therapy and help you to bring it to more Singaporeans as well. Thank you, Rodney, for being here. And that was episode 17. Rodney Lim, the pioneer of painless laser acupuncture in Singapore. And I'll see you all real soon. Hope to see you in episode 18, 19, 20 coming up real soon. Vicky Vaswani, founder of GrowCast Show, checking out.
Thank you very much, Vicky.